Dear friends, good evening. Repeatedly, I get calls from so many parents stating that, no, sir, we are sending our girl child there. We don't want them to practice in US. We'd like to take them back to India. Then what we have to do? And most of the doctors who have got their son, they say, doctor, we don't want to work my son, be there in America because I got a big hospital. I got my own investment here. So somebody should come and take over. For which can my son come back and what is the thing, everything they wanted. Though already I explained you, again as a special thing, I want to emphasize it in a very clear way. Repeatedly I tell you, you are going to write the assembly part 1 at the end of the 3rd year. At the end of the 5th year, getting the MD degree, you are going to apply for the assembly part 2. Then you are going to work as house surgeon there. It's called a senior internship with a stipend, not salary, stipend of 3 lakhs per month for 5 years. Within the stipulated 5 years time, you can finish off your assembly part 3. But our Indian people, they do it in 9 months to 1.5 years. That you take it from me. After completing that one, they have to appear for the board exams. This is common for anybody and everybody. If at all you want to come back to India, because you already completed all the exams, you will be considered as a MD given by American board certification. Repeatedly I tell you, within the bracket in MD, you can put the, what is the faculty you can put? Then again, what's the branch you can put? Then again, AB. If 10 applicants are there for to enter into any of the corporate, if they see one application with the MD, AB, immediately they will consider that one. That is the value of AB. That is, the American board is such valuable. Because everywhere and anywhere in medical field, somebody comes from US with a AB sign, they are considered very great. So repeatedly I tell you, I emphasize, you can pretty much come back to India and you can practice there as an MD. Because American board certification is valued globally. Thus, don't accept because Dr. Muthukumar is telling you, go and check in the Google, you write American board examination, automatically all the things comes. And moreover, our Bay University, we have got a recognition from the WHO, World Health Organization. What do they want? And people from India, the Medical Council of India, already they paid a visit, they made out things and they give it in writing, stating that it's okay. So what are the things to be done? We already did it. So casually you can finish off everything and comfortably you can come back to India and you can work here as an MD. Again and again I make it very clear. Even you can appear for government exam. You can even appear for any job, any corporate offices. You are repeatedly tell you are considered as MD. Because it is given by the American board certification. That is globally accepted. Kindly go through the Google and have a look, then only you will be convinced. Once you come back, naturally, from any country, if you want to any country, you have to write an exam. There is a concept. So when you come back to India, you have to write an exam, come here. That exam will be very simple to your thing, I tell you, because it is England-based for Indian doctors. It has been designed. But already American US Assembly syllabus is very tough. But people who have already gone through the toughest exam, they will find it very simple to come through and get through. That is the thing I can repeatedly tell you. So easily you can come and join and work as a MD, within bracket AB. Whatever branches that been given by the board, it will be with you all time. So don't have any doubts. Repeatedly I tell you, don't have any doubts. It is possible. MD, throughout the world, nowhere else, MD you can get and come and get through. Only 5 countries they say, one is America, Canada, UK, New Zealand and Australia. These are the 5 countries where that degree is allowed. But not even India. Very sad to tell you. But this is a medical fact, which I have to tell you. Okay, so you can come back and pretty much you can have your own practice here as an MD. So kindly consider, you will not even finish off your MBBS. By then, in America, you will be finishing your MD. What else you want? In Tamil, there is the truth, there is a saying. When you got a fruit, why you go for unripe fruit? You got a fruit, ripened fruit. You got an unripened fruit. When you got a ripened fruit, take the ripened fruit, enjoy the fruit. Why you go for unripened? Kani irpa kai kavarndatru. What does it mean? When you got a ripened fruit, go for that. Why you go for unripened fruit? This is what repeatedly I am telling. In 5 years you are getting MD. Then why are you waiting to get MD for 9 years? What is the fun in it? 4 years of your lifetime. Your youth, you will miss it. It's a waste. Repeatedly I tell you it's a waste. So I don't like my people, my children, my relatives, of all of you, I consider you as my relative. I tell you, I don't want anybody to waste their youth in simply getting through one MD that is not even recognized in the blood. You have to go and work there for 2 years. Then you have to write the exam. Then you have to go through. Then only you will be allowed to practice. Very sad thing. And whatever I say, with all humbleness, I'm talking about whatever I say, I mean it. Okay? Thank you. Kindly answer. Thank you. Bye. God bless.